Welcome everyone to week 9 of SDAHO's Legislative Update podcast. First off, your overview on the 2026 legislative session.
Welcome everybody to our last podcast of the 2026 legislative session. Unless something bad happens on veto day, which I don't foresee. There's certainly no healthcare bills hanging out there yet. So it was a grind, as you all know from our updates during the course of the session. And there was 4 or 5 weeks there was real tough in healthcare space, and we had just a great success rate. Killed 100% of the bills we wanted dead, and couldn't have gone much better from that perspective. And we'll talk here a little bit more about money and some other things that came in. But overall, honestly, just a great session. That doesn't mean it was easy; just mean it ended really well.
It could have gone a lot worse for us. One thing we didn't really have, I would say, offensive bills that we brought this year. We certainly tucked in and supported a lot of different bills out there that were good for healthcare. But glad to see that everything that we were opposing, we were able to get rid of. And then, looking into next year, I think we may have some bills we bring forward. And so hopefully we get a more healthcare friendly landscape for that.
Government relation folks, these are SDAHO members, but they are out there and they are assisting you, helping you. They represent their own systems, but they are very much impactful on the landscape when it comes to healthcare bills. How would you describe your relationship and that partnership with the GR teams?
There are government relation folks from Avera, Sanford, and Monument as whole systems out there. We really work hand in glove daily, literally hourly for much of the session. And gosh, we just have such a great relationship. And it's kind of, I think, that strong team that really helped drive our success this year.
Yeah, and I don't know if it's just their physical presence in the Capitol, right? That's great to have them there with us throughout the whole thing and working with legislators on all the various bills, but having them and the resources that they represent. And so when we have questions on things, being able to use them as sounding boards really helped Tim and I through the entire thing. So can't say enough great things about the team we work with.
Tim, let's start with you. The biggest wins from this past session
are defeating the attempt to put Medicaid expansion back on the ballot as a resolution, to kill that first basically step of the way in the process. That really set the tone for us. At least it gave me a little peace knowing that we could probably stop a lot of bad healthcare stuff. And that really was probably one of my biggest wins, to be honest with you.
2 big things. One, the 1.4% for Medicaid providers. Going into session, we were anticipating 0% from the governor's budget. So to see that they found that additional funding was huge. And then on top of that, our critical access hospitals are seeing a total of $2.8 million being added into the social services budget. That allows the department to move forward with the new hospital rate methodology that honestly we've been working on since last spring when they kind of rolled that out. And so those dollars are going to go forward and make sure that through the process, all of our members are at least held harmless and aren't taking a cut through that. And with that said, just so you're all aware, you should have seen communications from both the department and from Tim come out this week. But on Wednesday, March 25th at noon Central Time, there will be a call for all critical access hospital administrators and their staff to hear more about the methodology and how that's going to be implemented going forward with hopefully a July 1 start date.
Every year, there are some lawmakers that really understand the healthcare industry, and they are true advocates for pushing good healthcare policy through. Tim, let's start with you. When you look at who those healthcare champions are, who would you list?
I would say my champions in each chamber, House Representative Taylor Rayfelt, kind of hands down wins that award. Not that there wasn't a lot of other really good healthcare champions. Taylor, number one. Senate side, again, same scenario, a lot of supporters over there, but Sidney Davis, in my mind, was probably our number one Senate healthcare champion. So just a lot of support. It's really nice to see that kind of broad support, and certainly on the House floor. It wasn't anything against the Senate. A lot of the bills we didn't like were House bills, and we never got them over to the Senate. So, Jacob, any thoughts on that or anything different?
Both of those were really rock stars in the health committees for us. I do think we probably should also mention our appropriators. And I think, Representatives Casson and Mucky, I think were really good partners for us on the appropriation side of thing, as well as the rest of the appropriators that move things forward. But looking at them just helping us with the critical access hospital methodology and the additional funding there to move forward.
We know that lawmakers will return at the end of the month to consider any gubernatorial vetoes, but they also meet throughout the summer for some special summer committees. Do we know anything yet, Tim?
I think the one we know that's going to happen is an EMS summer study again. I think this one is a little bit more refined than last year. That was kind of I call it more shotgun approach to looking at EMS and the challenges. Through that, I think they've narrowed down to really probably two areas. One, funding, how we would fund EMS across the state going forward. And that's really going to be the focus of this summer study. Tangentially to that, there's an insurance bill that came up this year that would have mandated, I think, 275% of Medicare minimum payment to every ambulance service across the state. That ran into some hurdles. I think just on its face, you can see logistically there's probably some challenges there. So that's going to be part of this kind of overall financial comp look at EMS. I think, yet to be determined, because on veto day, they'll come back and executive committee will meet and decide what summer studies are going to do. I didn't hear a lot of chatter about healthcare related summer studies. I don't know if you did.
Pending what we see come out of those summer studies and with me here in Pierre, whatever they are, generally I go over and still listen in on what's happening. But the other big thing I think, we could talk about is we've got a primary election coming up. And with the turnover that we see, year over year within our legislature, I think it'll be very important to make sure that we're following along closely and making sure that we lift up and prop up those healthcare champions who have worked with us in the past or that are looking to either get back into the legislature or get in for the first time and trying to make sure that we have a good healthcare voice in the 2027.
Very good, Jacob. We'll stick with you and we'll end with Tim. Final thoughts and/or thank yous during our last podcast for the general run of the legislative session.
A big thank you to that GR team that we worked with. I can't say enough nice things about kind of the team that we've built and have going forward. And then a thank you to everybody who, when we send out those action alerts, I know it's easy to just ignore it and hit delete on that email, but those really are impactful. When those legislators hear from their local constituents, telling them how this problem impacts them at a local level, really is just amazing. And so thank you to everyone who took the time to send an email, phone call, whatever it may be, and reach out to folks for us.
I would, maybe just end by saying, we try and work as hard as we can to do good things in healthcare policy. Appreciate all your feedback, any thoughts or advice you have for us going into next session. Find us over the summer and look forward to those discussions, but looking forward to another good legislative year next year.
And that wraps up our 2026 legislative update series over the past 9 weeks. See you next year.